Hey, good morning. This is Dr. Stephen Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Jr. Family Broadcast Studio. Welcome back to Open Mics with Dr. Stites. You can find me here every Wednesday talking about all things COVID, as well as other topics, but COVID. And today we have two guests who are going to join us to talk more about COVID-19. In studio with me, okay, now guys, today is a pretty cool program because we have a husband-wife team and we're going to have some fun with that. In the studio with me is Dr. Catherine Satterwhite, Regional Health Administrator for the U.S. Department of Health and Human Services, along with her husband, Dr. Lewis Satterwhite, Pulmonary and Critical Care Physician here at the University of Kansas Health System. These are both extraordinary people, but today we're going to like Catherine, we're going to give him a hard time. We'll hear from them soon first, but we're going to go to our good friend, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, to share our COVID-19 inpatient numbers from overnight. Hawk, how are we doing today?
Yes. Well, Hays has 9 total, 7 active and 2 recovery. We unfortunately have gone up again. 46 total active patients with 19 in the ICU, 12 on the ventilator, so a very large percentage on the ventilator. 7 of our total 46 patients are vaccinated. 5 of our 3 of our 19 in the ICU are vaccinated. And those patients have significant comorbidities with morbid obesity, asthma. One had an MI, heart attack. So, again, the majority of these patients that are coming into the ICU continue to remain unvaccinated. And we do have a large age range as well.
Darn it, up to 46, and we know that school's reopening, Hawkeye. I'm feeling the upward pressure. I got my fingers crossed the masking is going to help us, but I don't think everybody out there is getting as masked as they need to be, and we know there's not enough folks vaccinated yet.
Yeah, I mean, I think that's the real problem, and there are still, myths or opinions going around about, can children, they can't get it, they can't spread it, which is completely false. Children can get it. Maybe the rates that we saw that children didn't have a lot of infection previously through the pandemic is because they were really asymptomatic, and the vast majority of them did fine. But we know, unfortunately, that there are kids that died and passed away and didn't have to pass away. We know that kids can be affected by the long haul syndrome and symptoms such as brain fog and fatigue. And I don't think anybody would want to see their 6, 7, 8, 9, 10-year-old having fatigue and not being their normal joyous self. So,
Hawkeye, there's been some misinformation hitting the airwaves again, and I'm going to just probably pull on our two guests here too as we talk a little bit about that. But first, let's see if there's any reporters on the line with questions.
Hey, good morning, Dr. Stites and Drs. Satterwhite. Doc.
Hey, Cody.
So Cody with Channel 9 here. We're talking about, you mentioned back to school, and I know the president and government officials are kind of, they're not leaning on the FDA, but they're like, okay, guys, let's get this going as soon as possible to get approval of the existing vaccines. We know Friday the advisory panel meets to discuss the possibility of booster shots for people who are severely immunocompromised. Once this approval starts coming in, and it seems like it's the projections are earlier and earlier, what does that open the door for as far as businesses, schools, that sort of thing, even your health system?
Well, that's a great question, Cody, and we'll take on the health system one first, and then I'm going to turn to Catherine Satterwhite to help us a little bit about what all the doors that are open, because I think that's probably an area of expertise of hers. Health system is looking hard at vaccination mandates, and I think you can expect something to come out here pretty soon. But I think that we anticipate, as well as what we're hearing, is that somewhere around September 1st, it's going to be fully authorized by the Food and Drug Administration, and I think that's going to make mandatory vaccination policies for many businesses much easier. Most of the people who have instituted the mandatory vaccine policies have a very long runway, and they often stretch into October and November. And so for most folks, when most companies or most healthcare organizations, once they do that, they're going to move right through the FDA full authorization, I suspect. And so if you're an employee at that place, for most of them, you can actually wait to see if it's fully authorized. And given that, I think the system is feeling pretty good about just saying, let's make sure it gets full authorization from the FDA. Catherine, talk to us a little bit about what that's going to mean, though, and the ability of people to say, okay, to all their employees, you're going to have to get this.
So I want to actually address a few points that you raised, Cody. First is that the FDA is very closely balancing the need to be scientifically rigorous and thorough and the public need to have both full approval for the vaccine for 12 and up for Pfizer, and then to extend the EUA to kids from, I believe it's 2 to 11 is what they're looking at right now. So once the vaccine is fully approved, it does open the door for us a lot. That it puts it firmly in the category of the vaccines that we already routinely recommend and in some cases require in different settings, whether that's schools, whether that's health systems. So it will give a lot more flexibility to different organizations, businesses, schools across the country to figure out where they want to put it. As to your question about back to school, and I believe you were addressing the EUA, the emergency use authorization that the FDA is considering to extend to lower ages. That's critically important because right now, kids, those 11 and under, do not have the full toolbox of infection prevention strategies. 12 and up, we've got everything. We can get vaccinated. We can wear masks. We can do all the infections of prevention control that Dr. Stites and Dr. Hawkinson talk so frequently about. But kids don't have that. So that's critical to getting them that very important, most important tool to protect themselves and their families and everyone around them in their community.
And so just to say, too, I think one of the things that you hear is that, oh, gosh, the FDA is rushing to get this done. And I think they are trying to rush to get it done, but I don't think they're short-circuiting the path to get it done. I think what they've done is taken the 100,000 plus pages of information, and instead of having, I don't know what the number is, but say 10 people on it, they've got 100 people on it. So they're going through the same information. They just got more people assigned to it so they can get through it because it's a public health disaster. And
in fact, they're actually going through more information. So the data that were needed for that emergency use authorization, that EUA, it's a subset, a very tiny subset. When we're looking at full approval, they have to do inspection of the supply line. It's from conception to getting that vaccine in the arm. It's a much longer, more thorough process to get that full approval.
So I think it's really important, Cody. I think the message needs to be the FDA is not shortcutting anything. They're working really hard at it. But I think the science bears out the truth, right? The science bears out the truth. Unlike some of the people who are out there talking about functional this or that and spreading things that are just inaccurate, like masks don't help prevent viral transmission, even though we don't have any cases of COVID-19 being spread on the floors because we wear masks. I mean, it's just that kind of stuff drives you a little crazy. But having said that, I think the key is in this situation, lots of good science that's showing that the vaccinations really work.
Absolutely.
Other questions, Cody?
One last one. The Kansas City, Missouri Health Department came out yesterday. And remember, they had this big 4-hour vaccination clinic at Arrowhead before the Garth Brooks concert. Some 70,000 fans were going to be in attendance. 35 people decided to get their vaccines before the concert. I was just curious about your take on that. I know some people might not want to get a shot right before they're sitting in the heat watching a long show, but just your thoughts on those numbers.
I'm hoping that 74,000 people were already vaccinated. How's that? Does that work, Cody?
I will add to, I also hope that 74,000 people are vaccinated, but we are at a place in this pandemic and in our vaccination campaign that 35 people getting vaccinated is 35 people who weren't vaccinated before. So we're in a place where we have to continue to offer the vaccine at all sorts of opportunities to give people that ready access so that when they're ready and when they make the decision to get vaccinated, it's right there. It's easy. So yes, I would have loved there to be more people. Because it's sadly probably 74,000 weren't vaccinated. But I'm also looking at that 35 as 35 people who were not vaccinated before.
You know, Cody, I think at some point, and I don't know what point that is, you have to stop listening to the made-up news network and the MUNs, because I think that it's such a disservice. You see people not wanting to wear masks because masks don't work. Oh my God, really? Do we still have to have this fight about masks not working when the evidence is absolutely overwhelming about how well they work? Again, you don't want your surgeon breathing into your wounds and while they do your operation, right? We wear masks all the time. Masking is not a new thing. And it is such a simple act of grace and kindness, but it's become an act of defiance to not wear the mask. And I think the problem in defiance is the harm you bring is to yourself and the people you care about. So if you want to defy logic and truth and just honest information, if you want to defy the facts around how well we prevent COVID-19 transmission or any disease transmission in the hospital, okay, defy the facts. But the person you're going to harm is yourself, the people you care about most, and yes, the rest of us who try to do the right thing. And at some level, we have to appeal to our better selves and ask ourselves, who is it we're trying to defy? What is it we're trying to say when we constantly try to make liars out of the truth? What are we doing by doing that? And I'm always stunned by our ability to take even the simplest messages of good and grace and turn them into anger and defiance. And I don't know where that ends. But I'll tell you, on this program, on this an open mics and throughout our medical news update, our goal is to simply tell you the truth, because we do it every single day. We work in this disease every single day. I heard a story yesterday about some guy who treated 15 patients, and that made him a world expert on COVID-19. Lewis, how many COVID-19 patients have you taken care of?
I heard that story, and I don't remember exactly where it came from, but my thought was that on Tuesday that you took care of 15 patients? We are, Dr. Hawkinson gives you guys the numbers every morning, but we're taking care of several dozen every day, and unfortunately some of those are here for a long time, and unfortunately some of those are new every day. So we're seeing new patients every day, and we see patients for the 25th or 30th day in a row sometimes, and it's both instances are heartbreaking.
And 95% of our patients are unvaccinated. This is not hard math, people, right? 95% are not vaccinated. 5% are vaccinated, and the ones who are here and vaccinated are the ones you really question whether they had a vaccine response because they're so chronically ill. They're the ones who we're going to get to this other point about other people. Do we need a third or fourth vaccine?
And I would just like to interject one point. The made-up news network is one thing. There are people who legitimately don't know. There are people who just really, do look at TikTok or social media. The Washington, but there's that other group. And that other group is certainly more insidious. And, a new article from the Washington Post talks about how Facebook now has banned groups out of Russia because of significant misinformation campaigns. Things claiming such that the vaccine turns you into chimpanzees. So there are other insidious groups out there trying to sow even further division and expand that division and lack of trust and authority for one reason or another. So I think it is very important to continue, if you know people who aren't vaccinated or who have concerns, really directing them to the right places, because there is so much going on out there. We all have access to Facebook and Snapchat and TikTok, and we really don't understand where that information is coming from or what is the reason those people are giving us that information.
And if I could add one thing to what Dr. Hawkinson said, because I do think that point about a lot of people aren't willfully spreading misinformation. So I think if you're aware of misinformation, there's a couple of things you can do that I think are important. First, try to determine whether it's true or not, and if it's not, or if you can't determine it, don't spread it anymore. But the other thing too, when you're talking to people and you're like, I know the truth, I know what the facts are, listen to them. Listen with empathy, because they're coming from a place where they might have an underlying reason for believing what they're seeing. So, and that reason could be very valid. So listen with empathy and engage in a conversation instead of just trying to make it black and white. So that's one thing. I know the Surgeon General just released a report about misinformation, and that's one thing that he talks about in that report, is that it's a continuous idea, and we all have a role to play.
And we have to engage in the debate. My concern is when people listen to the Internet Scientific Institute and Society, or ISIS, I just went there, the Internet Scientific Institute, that really you're going to compare that to the things coming from people who are trained in this world and do this world every day. You're trained in this world. You're a PhD researcher. I mean, this is your world. So talk to me a little bit about how do we engage in a conversation, because I know you all have to do this on a regular basis. How do we engage in a conversation where people just misrepresent the information?
Well, and I do think it's a difference between willful misrepresentation and lack of awareness.
Yes.
So I think if it's a willful misrepresentation, that is a much harder thing. Because then you're engaging in a conversation where people are pretty sure of what they're saying. But still, I think you have to come from a place of listening. I know that that's something we do in the medical profession. It's something we do in the public health profession. If we don't listen, then the conversation stops.
Yeah, I think something that we've done more conversations at home about empathy than we have in previous years, and it's something that we're talking about as we're taking care of patients in a very different way than we were a year ago, and having to remind ourselves to take a deep breath and take a step back and try to understand where people are coming from if they've made decisions that we think are not helping to protect their health in the best way. And there absolutely are instances of willful misinformation out there, and we need to combat and confront those. But a lot of the one-on-one interactions we have are with people that are coming from a genuine place. They've been, in a sense, victims of that willful misinformation. They're not, in and of themselves, individually, out there to cause harm to themselves or their families. They have been the victims of some of this information that's been put out there, and they went with open hearts and good intentions to try to understand, and they have had bad information and bad resources. But in that moment that we're seeing them in their vulnerable and critical stage, we have to try to understand that it's a very difficult situation for them, and we're there to help. And oftentimes it is an opportunity for themselves, as they're hopefully recovering it, or their family members, to then take a step back and say, how was it you came to this decision, and has this changed, and can we change that going forward? And a lot of times we're making very small increments of change, not unlike the Garth Brooks concert with 35 people getting vaccinated, but sometimes it'll be a small community or a small family where no one was vaccinated. A family member gets sick, and then you can talk about how they came to that decision. And oftentimes we are seeing patients that are family members seeking out vaccines and or social distancing, masks, and other pillars of prevention, infection prevention, unfortunately having a very, very difficult lesson on the why to create that moment of change.
Other reporter questions this morning? All right, not hearing any. Then we get to go back to some of our other discussions. There's so many questions we may have already hit on so far. Okay, so COVID-19, major public health burden in the world, with vaccinations rates where they are now. What can we expect to happen next?
Oh man, I know lots of people are making predictions. The reality is, I think we're in a little bit of a stretch where we're going to see some increases. We know that as much as we're encouraging vaccination, it does take some time for that vaccine to become effective. So we're in a place where we're seeing increases. We certainly have seen lots of high disease burden in Missouri, and we know that that's creeping into Kansas. And in fact, I cover Iowa and Nebraska as well. We are seeing increases in Iowa and Nebraska. It's kind of been a trailing effect. We've seen Missouri, then Kansas. Having said that, we have so many tools still, even beyond vaccination. We want people to get vaccinated. Please, if you're not vaccinated, engage in those conversations, get the information you need to hopefully choose to take that step. But even if you're not, or if you get sick, so first of all, there's a couple things I'd like to highlight.
Please.
First, if you don't feel well, get tested. Because we want to detect cases as soon as possible, and we want to do that for a few reasons. One, because if you are positive, then we'd like for you to stay away from other people, to stay at home, recover, and try to prevent spread that way. If you do have symptoms, there are treatment options for you that can keep you out of the hospital and make Lewis's job easier. So if you are positive and you're having symptoms, talk to your doctor about whether you can get a therapy called monoclonal antibodies that is really effective and can help keep you out of the hospital and keep you from getting more sick. So those are probably the two main things we have in addition to vaccines: testing and early treatment to keep people out of the hospital.
Really important news, and so thank you. So the Delta variant and the Alpha variant, does it feel different to you, and how different has it been from a public health perspective?
Yes and no. I mean, I think probably all of us are having a little bit of flashbacks. So in terms of disease ramping up, yes, that part is similar, but with vaccination in our toolbox, that feels a little different, and we certainly know that Delta is more transmissible than previous variants have been. So I think that re-implementing some of the mitigation strategies, some of that Swiss cheese model that you guys talk about, is a little bit harder this time, it feels like.
Yeah, nobody wants to go back to masking.
Yeah, it's
nobody
really
wants to
hard.
go back to
I didn't want to
distancing.
go back to masking. I think probably none of us did, but it's really important, and we did it. And our kids wear masks, and so that's something that we have prioritized as a family to keep us safe, to keep them safe. We're all vaccinated, but we're still wearing a mask because that's important, especially in the Kansas City area where we are in that area of high transmission, and it is recommended by the CDC.
It is. And you say, why aren't we vaccinated in this room? Well, if you sit here, you'll know why, because there's a negative airflow, and you can feel the breeze coming right across you, going right up out of our vents. And that's by design in here. And in addition, I think all of us are vaccinated. So
Yep.
that's what the CDC does say. If you're all vaccinated, you don't have to wear a mask. Okay, let's talk about a little bit in the ICU, Satterwhite, because when you go up there and you look around, things are still busy. They're hopping, and they're hopping not only with COVID-19, but you guys are just full right now.
Yeah, I think in many ways, when I think is the Alpha variant and Delta variant different or not different, that's one of the things that stands out. For all of our individual patients that we're taking care of right now, there are not a lot of obvious differences between the Alpha variant and the Delta variant as it impacts individual patients. Patients manifest disease in different ways, but broadly speaking, it's mostly similar. The transmissibility is different. But what we are experiencing and dealing with in the ICU that is very different than, say, December and January is that despite our COVID-19 numbers being lower than they were in December and January, our overall number of critically ill patients is even higher. We are just busy.
So not just COVID-19, but all ICU things.
All ICU things, and that goes across. So I work in a medical ICU, but we have colleagues that work in ICUs across all forms of healthcare, and they're all busy. We're busy with all of our cardiac cases and our neurology cases and all of our cancer cases and transplant cases, and everything and anything is busy and really high acuity. People are that we're taking care of are really very sick, and many of them. Some of that probably is a leftover of deferred health care from when people were hesitant to seek their primary care or addressing other health issues, and some of it is just that we have to take care of things. And it's interesting what we try to titrate and consider elective, urgent, emergent. Things that were elective a year ago can become urgent or emergent if they're not dealt with, and so we can only defer care so much. We're very busy with all of healthcare outside of COVID, and then you add in a significant COVID burden on top of that, and it really stresses the system. I think we're responding to it very nicely, but it stresses the system.
It does stress a lot on the system. Do you think people are sicker with the Delta variant than the Alpha variant?
Individually speaking, I don't believe that's true. Going by public health measures rather than individual cases, I think it's clear that it is more transmissible. But in terms of individual morbidity and mortality, I don't know that's the case. I do think that we have seen a higher number of patients in younger ages than we did in December and January. I think that's multifactorial because the vaccines have been taken up more broadly in older patients, and unfortunately a lot of older and elderly and vulnerable patients have suffered and died, and so there's some of that, but we are seeing more critical illness in patients in their 30s and 40s and 50s than we did in December and January.
I think a lot of that is going to be the transmissibility. So as you look at where we are in the pandemic now, does this hurt?
Yeah, it does hurt in so many ways. I mean, it hurts for the things that we're giving up in our personal lives. It really hurts for the patients and the families that we're taking care of. From a esprit de corps and a staff sense, there was a lock arms and let's get to this and let's do this. And we were down to 2 patients in March. Right? Yeah,
we had an inpatient census of 2.
And I don't know if that was, really almost making it there, or it was part of some undulations. But it really felt like we were seeing, maybe not the end, but I think a lot of us felt like we were going to find a very slow burn, manageable level, and not in everyday emergency crisis mode. And we're back to emergency crisis mode. I'm having multiple meetings every day with our nursing leadership about well, if we get one patient in the next hour, where does that patient go? What if we get 4? What if we get 7 overnight? Where are we going to do? What patients are we going to move? And just the grind of not only taking care of the patients in front of us, but trying to understand what's going to happen in the next hour, 6 hours, 12 hours, 1 week can be exhausting.
It is exhausting. I think we're all tired. And you guys got to really be tired over at HHS, but this is exhausting.
Yeah, so just thinking about, not being super psyched to put the mask back on. But yeah, and it's both Lewis and I have been, 18 months like you guys have been. And I work with a lot of state and local public health leaders in addition to my federal partners. And I'm not gonna lie, we're tired. We're tired, but we're also committed. It's our job, just like it's Lewis's job to talk to patients and walk them through what can be a very difficult situation. It's the job of public health people to protect the public, even when they don't hear us sometimes, or even when it's a struggle. So yes, it hurts, but we remain committed.
Yeah, and it's got to be, and it's just hard. And Hawkeye, you see so many patients, I know, with COVID every day. What advice would you give to our audience about all these different things we've talked about?
Yeah, I think it still continues to go back to vaccination. Right now on the floor, again, I'm seeing, I told this story the other day, a gentleman whose wife is vaccinated and got COVID and had some scratchy throat and a cough for a day or two. This gentleman unfortunately got admitted to the hospital and was on high flow oxygen. He got all the treatments that we give, but I think the resounding story, and the story we hear in the media too, and when you see people in the ICU and you see other physicians doing live interviews with them, is I wish I would have gotten the vaccine, and I think that continues to be the resounding story.
Yeah, I think it does.
I was going to say, I've clicked through the internet on various websites and clicked on some of those videos of that patients put out there, and we have not on camera necessarily, but lived that in our ICUs over and over and over. Those stories are not one-offs; they are daily and routine. And
have you ever had a patient in the ICU who said to you, as I'm going on a ventilator, respiratory failure, I'm so glad I'm not vaccinated?
No, I'm not. I mean, it does put a fine point on the issue of at what point can someone. But no, I've not ever had that. I've still talked to patients that even in the ICU and breathing well enough to converse and have a conversation, which is not all of our patients, talk to us about the concerns they've had about it, and or friends or family members they know that they have heard that had a reaction, and those kinds of things. So the fear and the mistrust is sometimes really embedded and difficult even for people that are suffering the health consequences from it.
And on the flip side, while we do occasionally hear about cases occurring among people who are already vaccinated, I have repeatedly heard, "Oh, I'm so glad I was already vaccinated. It could have been so much worse."
Oh, it would have been so much worse, right? But that's what we know. 99% of our deaths are in the unvaccinated. Now, I'm just saying.
Nothing's perfect.
But no, nothing's perfect, but it's 99% of the people who are dying are unvaccinated. Mm-hmm. So, we always said the vaccines are going to protect you against serious illness and death, and they continue to protect you against serious illness and death. Right. You may still get the Delta variant because it is a variant. It is different. Do you think that Moderna and Pfizer are going to reconfigure their vaccines to have more activity against the Delta variant?
I think that they are actively testing that right now, and the really cool thing about the mRNA vaccine is the platform is really versatile. And Dr. Hawkinson, you might correct me on this, but it's I think the way we do the flu shot, we change the flu shot every year. I think the mRNA vaccine platform is going to be really well suited to making adjustments like that. But I don't know if you.
Yeah, I think early on when the other pre-Delta variants were circulating, there was a large concern about the South African variant, which is Beta, maybe?
I don't remember now. It's a long time ago.
Basically, it was 1.351 out of South Africa. So I think we did see some reports Moderna was kind of pivoting their spike mRNA to resemble that one. But I think the lucky thing that we do have is those conserved regions on the spike that we are already in those vaccines. So they still provide pretty good protection. But on the other hand, I wouldn't be opposed to pivoting on some of those spikes and developing specific antibody reactions to that. But luckily, the vaccines that we have right now certainly do continue to provide good protection across all of those variants.
Dr. Catherine Satterwhite, what message do you have for parents as school is about to start or has started already in some areas?
Please support your children in wearing masks. That's my main message, especially for those kids who aren't yet eligible to get vaccinated. I think that as a parent who did have kids at home at some point in the last year and a half of school, I think everybody would agree that our kids are better off in person, and the best way to do that is get them vaccinated when it's eligible and have them wear a mask until they can.
Catherine will certainly know the public health message, but we can speak about our personal experience for those children that can be vaccinated. I think that that's something we would absolutely encourage. But we, as a family, experienced a school year with our children in school, not vaccinated, and not only they, but their entire classroom stayed healthy because they took distancing and masking seriously, and they did such a good job with it. And so to encourage parents to support their children in that, and every child is different, but broadly, I think children really do well with that message,
they do a great job.
Been impressed with our kids as well as a lot of their friends and the community as a whole.
Okay, so here's the real question that our entire listening audience wants to know. Okay.
Oh my gosh.
Dr. Satterwhite, Dr. Satterwhite, y'all are at home. You're having a discussion. Who wins?
Our daughter.
No, that is you can't
Kids never win. That is a recipe for disaster.
I don't know, man. She's pretty tough. I would say that honestly, we ebb and flow with
vaccination.
That's what I was going to say.
No,
That's not true.
I heard you go there.
We ebb and flow with the kind of heavy conversations that we have at home right now. Home is, I think, a place of comfort and rest for us. But when we have discussions, I don't think we have discussions. We don't have arguments.
You don't have big fights.
Discussions.
Okay.
And they're just, collegial.
She's so nice to you right now. Is that really the case?
Not at home. No, no, absolutely.
I bet Catherine
we
wins,
come from
just the
things
thought.
from the same point of view most of the time.
Yeah. All right, Jessica, what questions do we have out there from viewers?
Well, since you put the Satterwhites on the spot, I'm going to do the same for you. Tanya
Awesome.
has a question.
Me? No.
Yes.
Stop.
Yes. Listen to this. Tanya says, speaking of husband and wife teams, when is my doctor, the other Dr. Stites, going to be on this program?
That would be an awesome get, wouldn't it? We'll have to try and see if we can arrange that. We'll talk her and see if she'll do that.
Definitely.
Yeah, we should probably do it. She would be great. We've had my daughter on the program once. All right, we'll work on that, Jess.
Okay, so we'll see if you have any poll with that.
Yeah, not much. Go ahead.
Okay, so one of our Kansas senators is watching this morning, Cindy Holcher. She says, I keep getting people telling me they have done their own research on masking, the vaccine, and COVID in general. Can you please outline the difference between research conducted by scientists and medical professionals versus research done by the general public?
Yeah. Oh, my God, how to start with this one. Okay, so, I was trying to be a little funny before, but I'm going to just hit it again. The Internet, Scientific Institute, and Society, because it's almost a club, right? This whole thing, I'm going to get my information off the Internet. That's going to be the source of truth for me. And yet, we also know, whether it's the COVID virus or anything else, how the Internet is an unfiltered source of information. And the problem with an unfiltered source of information is you really don't know the quality of the information that you're getting. And that's one of the things that science strives to do on a regular basis. When we put information out in the public, that information has to be reviewed by other people, it's critiqued, mistakes are fixed, or the science may be repudiated, it may be thrown out. So when you see things appearing in the New England Journal of Medicine or in JAMA or in whatever, from even the MMWR, there are people who are reviewing that about its authenticity, its accuracy, its validity. Who is reviewing the Internet science? Who reviews that? And the answer is no one does. Anybody can post whatever they want. And that's why we call it the made-up news network. People don't really review the information, they just say it. So if I went to a bank and I said, here's how much money I make, I want a loan for that car. In fact, just give me the car. And I never challenged that. Nobody ever looked at that. What would happen? How would that work? But instead you go and people review those things to make sure that what you're saying is true. But on the internet, there is no source of truth. It's only in the beholder's eye that it is true. And that's not a very good place to determine truth because we bring our own biases into the room. Rather, the point of trying to do the whole scientific method is we spend time trying to go through the information and cull through it. And that's why the FDA takes a long time to determine if a drug is safe before it's released to have everybody take. That's the point of science. But in this case, now I'm going to turn to you, Catherine.
Yeah.
You'll say this much better than I did. I just used a lot of words, but you'll get right to the point.
Okay. So I actually think it's, first of all, a very good question. And the first thing that I would suggest in a scenario where somebody says they've done their own research is to say, that's great. I'm so glad that you're going out there and looking for information to address your questions. And that goes with the whole listening and acknowledging. So they want to do research, which is great. And then the next step is trying to support quality sources that we know have that scientific backbone. Unfortunately, to engage in conversations takes a lot of time in these situations because then it's like, well, I'd love to, understand or to see what your research is, and then engage in that back and forth to listen with an open mind, with the hope that you can encourage whomever you're speaking to also listen with an open mind, and maybe get a little bit of better information in people's hands.
And if I could interject too, and I think it's an individual thing as well. I think it starts with the base of knowledge, and it's that base of knowledge that you get and you start to get when you start to go to medical school or any other level of higher education, whether that's for a PhD or something of that nature. It's that ability to look at what is that actual research and critique that. And it's not just cherry picking certain numbers or certain sentences out of a research article, which we see that happen all the time by the media, by people who are in positions of power. Will cherry pick certain numbers, will cherry pick certain statements, which are really not in the context and don't give the whole answer to what that question is. So I think it's that ability to critique. It's also that experience that we have. You don't want me teaching your kids how to read because I'm not an expert at that. I don't know the best way to reach them. You don't want me fixing your car, picking your stocks because I'm not an expert at that. But what we have done is we have that base of knowledge. We have years of experience, and we know how to hopefully give that message eloquently, and so people can understand it, but also understand that we are able to critique what that research is and really pick out what are the salient points, and then hopefully give those to you in a concise manner so that you understand it rather than just a headline that we see on the internet.
Anything you want to answer?
I would echo what everybody has said, but I would say trusted sources. So finding your own research, doing your own research, or finding your own research is wonderful. And if it brings up questions for you or challenges the things that you think you've understood, take that and then engage in a dialogue with your healthcare provider or with a trusted source that has looked at this and other things like the CDC or other public health organizations. But I think it's what Dr. Hawkinson is saying, that there is a lot out there, but then they can be conflicting information. So take it to someone that's what they do with their profession.
I would also just say that freedom of speech is a constitutional right, and I think it helps protect our democracy, and it protects all of us. Telling the truth is a moral responsibility, and that is also something that helps protect all of us. Jess, next question.
Donna asks, how can we get COVID under control when vaccinated people with no symptoms can still spread it?
Well, that is a really good question. So let's take that on, guys, with this panel. And I think that the bottom line is that while you can still spread it, it's likely not as you're not going to spread it as much as those who are unvaccinated. At least that's what I understand. But the second thing is that's also why we wear a mask. And the third thing is vaccines still protect against illness, severe illness, and death. So whereas earlier with the Alpha variant or with the original strain, it looked like vaccinations really helped prevent disease transmission from one vaccinated person to another. That may not be as true with the current let's be clear, the current configurations of the vaccines, those could change, but with the current but it is still likely reduced, and it is clearly reducing your likelihood of severe injury and death.
I think you said it well.
Hawk?
Yeah, I'm still looking for more science on this. We have seen, ever since the beginning of the pandemic, some new variants come up and it's more transmissible. I want to understand really why. We know that certainly you can have elevated mRNA in your respiratory tract. We've seen that. What exactly does that mean? We know that alpha can be more severe or reduce the immune system because of other non-spike proteins and interactions that the virus has. So I'm just looking for more science on that. But at this point, we know what's going on. We know the devastation that it has caused in Springfield and how Delta is currently reaching other areas and outcompeting other variants at this point in time. So I think we need to continue to be vigilant and continue to get people vaccinated, because we know these vaccines still are extremely effective at keeping you from going to the hospital and extremely effective at keeping you from dying.
Yeah, and I think that's a really good point what you made too, is but we have to remember, and Liz, you can help us comment on this, the Delta variant is hitting some parts of the country. These are the highest numbers in Florida, Georgia throughout the entire pandemic. Yeah. So it's not like, oh yeah, it's another minor wave. No, this is a major wave in some places, in many places, Springfield, Florida, Georgia, and other parts of the Southeast, Louisiana, where this has been the worst they've been.
Yeah. That's right. I mean, it is very reminiscent in that sense of the spring of 2020, in that we really saw these spikes geographically, and we're seeing the same thing play out, and that probably has to do with how much disease burden there was in those places over the past year, and the transmissibility and where people are with their personal exposure risks or mitigations thereof, and some places in the country are seeing more right now than they ever had.
And I think one of the things we're hearing too, and you said it earlier, so let's follow up on the point, that when people are getting sick with COVID-19, you're trying to find them in bed, but the reality is everybody's sick. So if you're having a heart attack or stroke or other time-sensitive diagnosis where every minute is critical, if you can't get to that ICU bed, that's a delay in care.
It's a delay in care, and it challenges our mission as healthcare providers. We broadly as healthcare providers, but specifically here at University of Kansas, want to help people in our community, people across the state. And what we would love to be able to do is every time someone says, "Hey, can you help here?" we want to say yes, and that's harder and harder for us to do because we want to say yes. But we also have the obligation to give the best care to the person right in front of us. And we only have so many beds, so many doctors, so many nurses, so many respiratory therapists, so many ventilators, and more in the last month than even back in December and January. We've been able to say it's not safe for us to move a patient from one place to another in order to give them the best care. And that challenges our mission, and we rearrange all that we can, and we are going to expand and fight against that the best we can. But the best way we can do that is if we all do what we can to reduce transmission.
Jess?
Jill is worried for a family member and asks, can you talk about treatment options for a person with heart disease who gets COVID?
Okay. Louis, what are you doing up there?
So we don't necessarily treat someone differently because they have heart disease with COVID. I mean, without sounding like a broken record, the first thing we would say is if you have heart disease, please do the things you can to A, not be exposed to COVID, and then B, to give yourself the best chance of doing well if you get COVID, which would be to be vaccinated. So with heart disease, we would have the same recommendations for anybody in terms of trying to avoid getting sick. But if you do get sick, do exactly what Catherine said earlier, which would be to, at the first sign of symptoms or concern about an exposure, to get tested, and then to follow up with your healthcare provider, because the earlier that we intervene, the better that we do.
I think that's really an important point, because at the end of the day, the things that keep us safe are the things we know to do. Eat well, exercise, sleep well, take your meds, and then wear your mask, get vaccinated. Simple formula, really.
Yeah.
All right, Jess?
What is the mortality rate? I cannot believe it's still 1%.
What do you think? What are we looking at, Catherine?
I honestly am not familiar with this stat. I would have to look it up. I do know that it's something that people track.
Well, that stat in and of itself, and this is absolutely Catherine's expertise and not mine, but it all has to do with how many people that have no symptoms, mild symptoms, or a lot of symptoms get tested. So with the same virus infecting the same people and the same outcomes, the measured mortality rate is going to depend on how many people are getting tested.
And the other question would be, of those people who come in the hospital, has the mortality rate gone up, or has the ICU mortality rate gone up?
I don't have that answer.
I could tell you, from our standpoint, it has not really changed. That once you get to the problem is that with the Delta variant, that it is much more transmissible. We're seeing what we have seen is a shift. We've gone from about 58 to 60 down to 50 to 52 years of age. Yeah. And remember, we're not a pediatric hospital, so that really means that when we have some it's not like we have that whole. We just don't. That's a Children's Mercy thing. We have a few pediatric young kids, but for the most part, we're an adult hospital. And so as a result, what happens is that our ability to shift our age down a lot is different because we don't have as many.
The lowest number is 18, essentially.
Yeah. And so, thank you. You said that much better than I did as I stumbled around at that point. But the reality is then that when we drop our average age by 7 or 8 years, that's a really big deal. And that's what we've done. The mortality rate appears to be about the same. It may be a little higher with the Delta variant, but I think the real key with the Delta variant is its transmissibility.
There was a week in July where I had more patients under the age of 40 with COVID than I did all of December and January together. I mean, you know the numbers, and like you say, the average age has dropped by a significant number of years, and that underestimates the real change that's going on. No question that right now, if you look at the patients that we're taking care of, they're younger on average than they were at any other point we have been in the pandemic.
Yes.
Kristen asks, as several people have been asking, can you talk about if you are vaccinated and have had COVID, are you more protected with this new variant or just the same as everyone else?
Okay, that's a very good question. I'm going to tell the truth. The reality is that if you've had COVID-19, then you get vaccinated, you have a wildly high number of antibodies. Now, does that make you more protected? One would say, yeah, it might. Still, bad idea. Don't go get COVID because you can get vaccinated and think you'll be more protected, because what we don't actually know is the final part of that sentence. We don't really know that you're more protected or if you're more at risk. We really don't know. We just know you have a lot more antibodies, which we think will maybe make you more protected. But here's the risk. With the vaccine, your risk of death is like virtually zero. That is not true with COVID-19. So I would be very careful thinking, I'm going to get COVID-19, then get vaccinated, then I'll always be protected. Well, you see, that doesn't make a lot of sense because you're getting vaccinated to not get COVID-19. If you get COVID-19, you have a risk of death. The risk of death is probably about 0.5%. That's 1 in 200. Do you really want to do that? I wouldn't want to take that risk myself. And the older you get, the higher the risk.
Yeah. And it doesn't take into account the people that have long-term symptoms. So.
Oh, yeah, that's another good. We haven't talked about that. And we don't know yet about vaccinated people who get long-term symptoms with the Delta variant. We're just too early in this process. But I think there is a concern. I mean, we're starting to see a few vaccinated people with long-term symptoms. My guess is we're going to see fewer than we did with the unvaccinated. And the reason is that the unvaccinated people will keep saying to us, with long haul syndrome, I feel better after I get vaccinated.
Yeah.
So.
A couple more questions. Okay, how are you doing?
One more.
Okay, well, kind of 1.5 because I do have to ask you one thing.
I knew you were
okay.
going to do that.
So Carrie asked, how concerned should I be when my vaccinated college student returns home, after a few parties and games and bars and all that good stuff? Coming back home, should I be concerned?
Well, that's a good question. What do you think, Doc?
Wow, that's a tricky one. I honestly think that we should see how CDC's guidance changes as we go back to school, or if they provide additional clarity on this. Historically, it would be that once your student goes to college, they are now out of your bubble, right? So that when they would come back, you would be 2 separate bubbles, and you would need to remain separate for a certain period of time, that 14-day window that we talked about. But I think it's a little different. Science does evolve, and we learn a lot. And if masking is occurring in addition to that vaccination, it's a pretty low risk. So I would say encourage your college student to wear their mask if they're going to a place of high to moderate or high to substantial transmission, or even if they're not in that geographic setting, if they're in a congregate setting, to get comfortable wearing that mask sometimes, especially maybe for the couple weeks before they come home.
How to manage individual behavior is a separate question, but I think the short answer is if you have a 20-year-old that goes off to college and is putting themselves out there and having a lot of exposures and then returns to a different home with a different generation or sometimes multiple generations, those other people in that household, even if everybody is vaccinated, there's risk there.
Okay, so Jennifer said she watched.
Last question.
Oh, last question, I promised you. And you
Okay.
you can give a 20-second answer.
All right.
Okay, and it's just for you. So she watched the CMO Zoom meeting
yeah.
last week. She
Yeah.
said it was very, very informative and loved it. She just said, could Dr. Stites please just give a quick recap, because she wants to be able to repost it on her social media for others to watch. Can you just tell her again so she knows how to properly tee that up?
I'm not quick at anything, as it
I
turns out.
know.
So, but here's the deal. So what we did is we had all the chief medical officers for the city come together, and it was Liberty, North Kansas City. I have to, in my mind, go through the geography. Truman, St. Luke's, HCA, KU, Advent, Shelley Mission, Olathe, Lawrence Memorial. So really, and Kansas City VA. So all of us were together on this conference. And what we wanted to do is to say to public health officials, to elected officials, to school officials, to city administrators, county administrators, and legislators, what we're really trying to do is put a message out there that your health systems are back to the point they were last November. In fact, we're worse than when we sounded the alarm in November because of the rapid rise in COVID-19 and the rapid increase in our hospitalization. And to your earlier point, everybody's full already. Before last fall, we didn't have as many patients. I don't know if it was masking or distancing or what it was, but we just didn't have as many patients, so we had more room. Today, all of us are full. We're all denying transfers from some Missouri. I was reading, last night about Springfield saying, hey, their numbers are finally dropping, which is great news. But they couldn't transfer anybody. They can't find a bed for patients because we're all full in the region. And so if we're all full, it means that if our numbers continue to spike with COVID-19, we won't be able to take care of those of you who have a heart attack or stroke or infection or sepsis or any of those other things that are time sensitive, meaning if we wait too long, your outcome is going to get worse markedly. And so we're just trying to say to folks, look, you need to go back to health measures that we know work. And the health measures we know work are to get vaccinated and to wear a mask. And that was really the overarching message. And we know that masking decreases disease burden almost immediately. And we saw that happen last year when we put on masks. We socially distanced, we flattened the darn curve, and then the curve dropped like a rock. So it clearly worked, despite all the folks out there saying blah, 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 blah. No, don't listen to that. Just look at your own proof right here in Kansas City. When we did it, it clearly worked. And what we're saying to people now is, we're not trying to tell you to socially distance. We're hoping we can get through this with vaccination and masking, but we need everybody to be a part of that so that we take care of everybody. That was really the whole message to the thing. And every hospital said exactly the same thing. So there we go. All right.
That wasn't
there
quick,
you go.
but-
It wasn't quick.
It was Stites quick anyway.
But it was
Stites
thorough.
quick.
It was
All
a good
right.
answer.
All right. So before we ask everybody their final thoughts tomorrow, Jess is back with another morning medical update. We look at how the COVID-19 pandemic is causing concerns regarding your eye health. Who knew? But it is an important point. Plus, you never have to miss a show now. You can subscribe to the podcast of the Morning Medical Update, as well as Open Mics with Dr. Stites now everywhere podcasts are available. So, Dr. Catherine Satterwhite, final thoughts today.
I just want to thank your viewers. I know that they have remained committed to learning the truth, to getting the facts, to sharing those with people they know and love. And I also want to thank them ahead of time for doing the hard things again, for masking up when we don't really want to mask, but we know it's the right thing to do, for supporting vaccine conversations when they can be uncomfortable, and for continuing to do the right thing and to get the facts. So thank you.
We want to say thank you for all your service and all the folks over at Health and Human Services who are working so hard to keep our public safe throughout this pandemic. These guys are stars, and thank you. All right, Dr. Lewis Satterwhite.
Once again, Catherine is one step ahead of me. My final thought was going to be
there's a
to
shocker.
say a thank you. Mine would be several thank yous. One, thank you for having us on
Yep,
today.
of course.
Thank you to the team here, Dr. Stites and the team here for doing this for, you guys know the dates, but I mean, well over a year and a lot of effort to getting information out and good information out. We've talked a lot about where do you go for a source of information, and this program has been a source of that all the way through this pandemic. So thank you to you guys. And again, like Catherine said, to all the listeners, because I think your attention, showing up here and seeking out a source of good information and then carrying that out to your interactions outside of this show with your friends, colleagues, and families, makes you part of the solution. And so thank you for that.
And thank you for all the great work your team up there does in the ICU, whether it's the nurses, the physicians, respiratory therapists, social work, case managers, the technicians, whomever. Just a big thank you for trying to help take care of us when we get that are most critically
Lots
ill.
of folks really working hard.
Yeah, it
so.
really is. Where do we go from here? Where do we go from here? And who defines that course? The answer to that is you. We know the answer, because you're going to determine the course just like you did last January when we bent the curve. And how did we do it? We followed the rules of infection prevention and control that keep you safe wherever you go. What we really want is for you to live long and prosper, in the great words of Star Trek. It's pretty darn wise. But the truth is, when they say, where no man is boldly whatever they said in that darn opening monologue, where no man, the answer to the question is, where do we go from here? You decide. And you decide every day by how you take care of yourselves and our world. Hey, finally we know that many school districts are requiring masks and COVID precautions. Sunny says, with this message, because some of these rules from last year are going to still apply. And by the way, just so anybody knows, this is Jess's daughter, and she's awesome.
Hi friends, I'm Sunny and I'm going in the 2nd grade. School's going to look a little bit weird this year. You might have questions. It might look different for everybody, but here's a sneak peek at what it might look like. Remember, Sunny says, have your mask ready. Make sure it's comfortable. You'll wear it most of the day. First things first.
Good morning, Sunny.
You might have your temperature taken at the door.
You're good to go.
Sunny says, it's okay. It's not scary. You'll probably walk to class alone. Remember to stop by the hand sanitizing station. Follow the signs and keep your distance. Your classroom might look like this. Desks will be spaced apart, and you won't get up as much. Instead of hooks or lockers, you might keep your things in a bin, close to your desk. You might have more iPad time. It's nice to share, but Sunny says no sharing supplies this year. That can spread germs. Sunny said, most importantly, listen to your teacher. You might have to eat lunch at your desk, but at least you can take off your mask. Sunny says, remember, it won't be like this forever. At recess, you'll see your friends, but still keep your distance. Remember, it's smart to stay 6 feet apart. Sunny says, don't use the drinking fountains. Instead, keep your water bottles full. You'll be asked to wash your hands a lot and use hand sanitizer. Hi, Michael. Hi, Sunny. If you take the bus, you'll get on and walk all the way to the back. Pick the first seat available. 1 kid to a seat, if possible. Sunny says, be cool at school, stay safe, and follow the rules.